The Good Life Health First is an initiative under the USAID as a relating social and behavior change being implemented in the northern and northeast regions of Ghana by the Ghana Health Service, Savannah Signatures, and other consortium partners to reduce the disease burden across multiple health areas, generate demand for an increase in the uptake of health service facilities, whilst creating supportive environment for behavior change. Addressing the gathering, a Deputy Regional Coordinating Director, Sherifatu Jima, who read the minister's speech, said the region has seen an increase in non-communicable diseases. She said even though there is an increase in cases such as cardiovascular disease, hypertension, asthma, and other cases of diabetes has seen a decline, attributing it to positive healthy behaviors adopted by the citizens.
I am reliably informed that non-communicable diseases such as diabetes, cardiovascular diseases, that is hypertension and stroke, asthma, cancers, and the others are increasing in the region. The region recorded 0.27% of diabetic cases in 2021. It declined to 0.24% in 2022 and further reduced to 0.11% in 2023. The continued decline in trend of these diseases can be partly attributed to the positive healthy behaviors adopted by citizens through accelerating social and behavioral change activities in the region. It is therefore abundantly clear that adopting positive healthy attitude can be beneficial and co-effective in preventing diseases than to treat them.
The Northern Regional Director of Health Service, Dr. Abdullah Yakubu, whose speech was read on his behalf by the Regional Health Promoter, said the Good Life Health First is aimed at bringing health service and health education to the doorstep of the people.
The Good Life Health First embodies the power of community-based interventions by bringing health services, education, and commodities directly to the people. You break down barriers to access and empower individuals to take charge of their health. Through practical demonstrations and direct engagement with health providers, community members will gain the skills and confidence to adopt healthy behaviors and navigate the health systems.
Executive Director of the Savannah Signatures, Dr. Stephen Agwanyo, said the collaboration is aimed at contributing to the Healthy Life campaign for a healthy population.
These health fairs are envisioned by the leadership of the USAID SBC activity, exemplifies the significance of today, June 20th, World Productivity Day, in many ways. Through the health fairs, we showcase how a strategy such as this, a health fair, can help us perform simple tasks but achieve more results, more health outcomes in the end. By doing all of this, we are contributing to a healthy population who will be more productive, and not just to their local communities, but to the nation, Ghana.
And that from the northern region was Martin Abugri walking us through some of the incidents of non-communicable diseases. But dealing with the growing cases of NCDs, as we call them, non-communicable diseases, what are the triggers? How do we prevent or manage them? Well, today we talk to the Ghana Health Service. We are interacting with Dr. Ifua Kome, Acting Programs Manager, Non-Communicable Diseases, Ghana. Thank you so much for joining us.
You're welcome.
It's good to have you. The last time the conversation was a bit patchy because of the phones, but and then the Waba studio. But tell us, I mean, what is the situation currently with NCDs? And maybe to start, which ones are we looking at? Because there are so many of them.
Yes.
There are the cancers, both childhood and adult. There's the hypertension bit, heart disease. So which ones do you deal with?
Okay, so my office deals with what we call priority NCDs in Ghana.
Priority NCDs?
Yes, we would have to select at some point. Priority because of, you look at the disease burden, and then you look at the preventive factors, sort of the lowest hanging fruits that you can easily address. So in Ghana, our top 4 are the cardiovascular diseases, diabetes, chronic respiratory disease, and the cancers. When you talk about the cancers, we are dealing with breast cancers, cervical cancers, prostate cancers, and childhood cancers. Beyond these, we also have NCDs that we've labeled as NCDs of special concern in Ghana. Something like sickle cell. You don't get the numbers as high as hypertension. However, it's peculiar to our region. And there's so much more that can be done in terms of prevention. Something like mental health. Mental health issues have come up so much. And then also you have something like injuries, which hitherto were not really considered in the health field.
Right.
Yes, there was a lot more considered around injuries by road safety, MTTD, amongst others. But it's crucial that the health sector is also able to address issues related to injuries. So these are the priority NCDs that we currently deal with.
Did you mention hepatitis, or was it the sickling cell?
Sickle cell.
Sickle cell.
Yes.
Hepatitis is not in there.
No, hepatitis is under a different unit in Ghana Health Service.
And now that we have the selections, so cardio-related issues, then diabetes, then the cancers, prostate, cervical,
Breast.
breast,
Yeah.
and then childhood,
Yes.
right? And then we have sickle cell
Yeah.
and everything in between. How are we faring when it comes to these NCDs? Any age?
Generally, we are not faring too good. However, when you always say we are not doing too good, it sounds like you're just going downhill, downhill, downhill. I'm sure.
So the glass is half full.
Exactly. A few years back, you wouldn't really hear much about NCDs. Our priorities were largely infectious diseases, maternal and child health issues. However, based on our disease trends, we've realized that the lifestyle issues are largely coming up to the extent that in 2022, the WHO estimate said that NCDs accounted for about 43% of our deaths in Ghana.
43%?
Yes, in 2022.
That's staggering.
By the end of 2023, we're doing 45%.
So 2022,
Yeah.
43%. Was that the end of 2022?
Yes.
By 2023, we were at 45%.
And this 45 did not include the injuries, which account for about 10%. So when you add
Wow.
that, it means we are doing like 55% of all our deaths being attributed to non-communicable diseases. So
huge.
if this is not something of concern, I don't know what else is a priority. It's crucial that as a country, we focus on these diseases, talk more about them. People assume that it's lifestyle, you should know. But no, people do not know.
In other
That is how
places, measures are put in place to even streamline how people live. Because once they get these things, it's going to be a burden on the health
system. Exactly. In other places, you'd actually be recalled when your time is up for screening.
Yeah.
So that you don't become a burden onto the system. They don't wait for you to catch the disease. And then so much money has to be spent on you. But when you screen, it costs very little. So that is the direction in which Ghana is moving, to ensure that routine screening becomes a part, at least for the adult population. We've done so well for the children. You know, we do the childhood immunization, childhood vaccinations, amongst others. But for adults, there's no structured form of screening. So as and when you want to, then you would walk in. It's about time we become more proactive in ensuring that screening is institutional.
And people will usually tell you about the money, the cost. You see, that's one place where we failed woefully when it comes to education.
Yes.
Because technically, let's take prostate cancer, for example. Those I know who have got it and gone through the cost involved. You get it. Compared to or juxtaposed with getting yourself checked every year
once a year.
And catching it quickly enough if there are any developments in there. I mean, there are the natural ones where as you age, it may enlarge, and those are normal. But are you checking your PSA? Are you knowing what is going on there so that you are not caught pants down and then you have to spend so much?
Exactly.
But I'm curious about something. When it comes to cervical cancer, for example, I know there are some, is it a vaccine?
Yes.
And you take it very young. Do we have it?
It's recommended for persons 9 to 14 years.
Exactly.
It's not routinely offered in Ghana now. However, I know we've applied to Gavi, the global vaccine,
Right.
yes, in order to ensure that we can get HPV vaccines as part of our routine immunizations.
That is the human papilloma virus.
Yes, a whole lot of work has gone on. We're supposed to get it pre-COVID, but immediately COVID came in, COVID vaccines became...
It changed everything.
Yeah. So it was put back on the table, and now by the early 2025, I know the EPI program is working to ensure that HPV vaccines are offered routinely in Ghana. Ghana was the first country to actually undertake the pilot. And it was proven to be very effective and acceptable even by the communities. So there's no excuse for us. And countries that did not actually pilot have gone ahead of us to start vaccinating their young girls. Yes.
And you mentioned, I mean, HPV and all of that, but just to find out, is this something that we could get from the Global Fund as well? I mean, in terms of the cervical cancer vaccines.
Avenues that can be exploited, and indeed with the National Vaccine Institute coming on board, is one of the key things on their banner to ensure that, yes, this vaccine is prioritized in Ghana. But even beyond the vaccines target, as I said, 9 to 14-year-olds. As young people age, we do have the option of screening. I would always come back to screening because it's like the lowest hanging fruit we can
It's your
afford.
life. I mean, you don't need... In other places, they are so... They want even to inform you that, hey, your time is up.
Your time
but
is
it's
up.
your life.
Absolutely. And there are very relatively cheaper forms of screening that can be done even at the CHIPS compounds for cervical cancers. Yes, and if any early lesions are found, we call them precancerous lesions, they can be treated right there and there, such that the lesion would not... Cervical cancer takes about 15, 20 years before it turns into a cancer proper. Prior to that, you have early lesions that start showing on the cervix. If you don't screen, there's no way you find out. So we are using that window to start screening women, and once the early lesions are there, you pick them up and you treat it, and that will be it. So for women that missed the opportunity to vaccinate, there's the option of screening, which has been shown to be highly effective. And screening, for us, we combine breast and cervical cancer, so you don't have to do cervical cancer at one point and then go do breast cancers at another point. So screening is critical for us,
I see. And that's quite a cocktail of, I mean, even as you're being selective, because if you look at NCDs, you would have Alzheimer's in there. There are some people who would have that. Even epilepsy, osteoporosis, and all of that are in there. But of course, based on what resources we have, we're looking at them. But
let me just add that for the other NCDs, they are being dealt under
other programs? Okay.
So my unit is just to highlight the public health component of the priority NCDs I talked about. It doesn't mean that things like Parkinson's disease, dementia, epilepsy, as you talked about, are not being dealt with. Yes, they are also being addressed, but under different groups.
Okay.
Yes.
So these are the ones under your umbrella. But quickly on triggers. I know these cancers, at least you mentioned the lesions when it comes to cervical cancer, but some of them will not show you anything. You are there, then boom.
Yes.
There may be signs, but are there any things we can look out for when it comes to some of these NCDs?
Absolutely. So for the cardiovascular diseases, which form the greatest chunk of NCD, so you are talking heart diseases, you are talking commonly hypertension. So for hypertension, almost everybody has heard something about hypertension. You are talking strokes, then you are talking other complications as well. For the cardiovascular diseases and diabetes, it's been found out that the lifestyle issues go a long way to trigger. There are few, should I say, natural dispositions. So by virtue of being black race, your body naturally retains a lot of salt.
Yeah.
So that in itself sort of raises your blood pressure slightly higher than other races.
When it comes to prostate, they say, hey, we are more prone. When it comes to hypertension,
but then the fact that that natural predisposition is there does not mean that nothing else can be done.
Right.
So the lifestyle issues, especially from our children, go a long way, starting with their diet.
Yeah.
Suddenly, the issue of fast foods have been normalized in our society. We've actually attached the reward system. Do well in school and I'll take you to...
Yeah, I know you don't want to mention.
Oh, no.
And you see, it boils down to this. I'll let you go on, but that background is crucial. Do you know, for example, till now, when I cook rice, I don't add salt.
Yep.
Because likely the stew, and even in my stews or whatever, I don't like too much salt. Because that's how growing
it's
up.
It's a habit. And it's
so that you're adding salt in the rice, you're adding salt here, you're adding salt everywhere.
And it accumulates.
Oil. If I'm going to fry an egg, my mom had this thing where she would mix it with a bit of water so it's not so much, or very little oil so it's pretty dry. Yeah. I mean, these are basic, small things,
habitual, and you need to learn those habits. Yeah. Otherwise, you get so used to the unhealthy lifestyle, you feel that is the norm.
Yeah.
Sugar, for instance, adding extra sugar into your tea, diet, whatever, it's a totally acquired habit. Yeah. There are naturally occurring sugars in almost all our foods. The ones that even don't have sugar have so much carbohydrate that they will be converted into sugar as well. So you just need to learn how to reduce the amount of salts and sugars you put in the diet. And once you get used to them, for instance, with the salt, it would mean that when you start eating other people's food, you realize that the salt seems a bit too much. You know, because you've acquired the taste of lowering your salt content. Yeah. And that is key, that all of us learn how to reduce our salts, sugars, oils, and all those healthy lifestyle issues need to constantly be drummed into us in order for us to acquire the habits. Yeah.
And my producer was just teasing me about something I ate last week. Sometimes the problem is when you go out and you are buying. That is where the problem is. I mean, sometimes you buy your wache or your jollof rice and you can literally, if you leave it for a while,
see the oil.
The oil.
Yep.
Hey, and why do we do this?
Body. The challenge is you don't even know the type of oil that was used as well.
Is it coconut oil?
You have no clue.
Is it sunflower oil? And even now that we are talking about oils, I know there are standards globally. Some of them say, especially for children's development, maybe there should be vitamin A to this level components. And a lot of them you check. I hear there are tests, Ghana Standards Authority and the rest, Food and Drugs Authority, and they are not meeting them. So even what you are buying on the market, you are not so sure
whether it has
it's giving you all of those things.
Exactly. Ultimately, I say that at least for the food that you cook yourself in the home, there's so much that you can do with that.
Yeah.
So why don't you take advantage and for the food that you cook yourself, ensure that it is healthy enough. Ordinarily, the amount of oil you would have used, try halving it. The amount of salt, try halving it. Sugars. When you go half, before you realize you are literally not putting any in the food. Yeah. And yet it tastes nice. I know a family that decided that they were not going to use spices in their foods.
Okay.
Because they have the onions, they have the bay leaves. Yeah. These naturally occurring spices are available. Because the man said that anytime he attends a program, he realized there's so much spice in the food, and he cannot tell where it's coming from. So the one in his home, that one he can regulate.
You control that one. When you go out, it's a different matter.
When you go out, it's a different matter. But with time, once we all keep insisting that let us regulate what we cook in the home, when your children get used to it, they get much healthier. We are not ultimately, most of these kidney diseases, kidney failure, and things that come up, you never know the kind of chemical that is going to trigger some of them. So foods that we put in them, it's crucial. That is the thing that we tend to underestimate. And then assume that once it is served hot, it is fine. Most times it is not.
It is not. And when you're buying your wache and the rest, you know, other things, what do they, is it saltpeter? Yeah. The saltpeter in there. I mean, some of them. So again, you should. Sometimes you actually bite.
Yes.
Something you're like, hey, makamo. But that's where you also need to regulate.
Yeah, exactly.
First of all, where are you buying it from? And if you're buying it from here and it happens, at least you're not consuming it every day. At least some of these things they build up over time.
Yeah, you can regulate the frequency at which you consume some of these foods, but I would always say that use the healthier options in your home. Right. When you get used to that, then suddenly you notice that the ones outside are not so healthy.
Yeah.
You start trying to find ways of ensuring that most times you eat from
Yeah,
the
eating
house.
at home.
Yes, and that would go a long way to help.
And you know those who the food is already salty. You are tasting that this food is already salty. Then they go for the salt
Extra.
shaker. And
Yep. Makes you wonder.
and then they'll come and be complaining, I have hypertension.
Yep.
But let's talk about the triggers. Are there any triggers generally that we should look at? We're already talking about some of them.
Yes.
But beyond these.
Yeah, we talked about the unhealthy diets, which are largely high salt, high sugars, high fats and oils.
So
Then-
please slow down. Let them hear it. Let it sink in. High salt,
high sugar.
high sugar.
Yes, and on the sugar notes, let us also remember the fizzy drinks.
Oh yeah,
Have
those
an
ones.
extremely high sugar content.
I'll not mention
And
brands, but
suddenly they are
small
sprouting
bit
up
in.
all over the place. Almost every other shop is selling these fizzy drinks.
do you know the ones I'm scared of the most?
For the
Those
children.
energy boosters, and then those ones are so high on so many things. And caffeine, it gives you an addiction, gives you something else.
And most of them, the sugars are highly addictive. So you start, you can't stop.
Wow.
So it's a means of ensuring that you go back to keep on buying. And now they've developed these paper-packed ones that our children are constantly taking to school.
Hey,
Some people said, catch them young. That's a very wrong age for us to start introducing them to NCDs. And it's showing up in their blood. When you are testing their cholesterol, their lipids.
children.
Yeah. Childhood obesity is all over
I
the
was
place.
just about to say.
It's showing up in the children. Diabetes, even type 2 diabetes, which normally you'd consider as occurring in older persons. We keep reducing the age to much younger and younger children.
What ages are we looking at now?
So I don't know what to say normally, but usually you see type 2 diabetes in persons about 40 years,
Yeah.
40, 50-ish, thereabouts. Now you're having 15-year-olds, 16-year-olds coming up with type 2.
We
They
used
were
to
not
look at
born with
over
it.
40-year-olds.
Yes.
I'm sure even in the past, over 50-year-olds.
Previously was above 60, but in our era,
15, 16-year-olds.
yep, they are now coming up with type 2 diabetes. They were not born with diabetes. They were born with it, it's type 1. That one, there's nothing they could have done about it. But then the acquired ones are now occurring at much younger ages, which should tell us something. And the same thing is even happening with the cancers. We keep on seeing much younger and younger people who are coming up with the cancers, telling us that, Jack, we are not doing so well at all with this. But then you talked about the other triggers, something like physical inactivity. It's been shown that even you being able to be physically active for almost on a daily basis tends to reduce your chances of getting diabetes, cardiovascular diseases, even as well as some cancers. So physical activity is like a natural medicine that has been given to us. And it's essential that we walk. It's not everybody who can do the running and the jogging. Let us just walk.
Walk.
There are apps on these phones that measure your daily steps, for instance. If not, just ensure that within every single day, you get up after 2 hours. Sometimes you can sit at your desk for hours on end. By the time you are done, you are so exhausted, you can only think about getting into your car, going home and sleep. Totally sedentary.
Lives.
So walking up and down the flight of stairs, walking around the building. These days, I'm even afraid to recommend that people should undertake these organized walks along the route because it is becoming quite chaotic. Vehicular accidents, amongst others. So let us be observant as we are undertaking these walks. Some people are able to walk up and down the mountains, which is good, but it's not everybody who can afford to do that. But within your own environment, let us take additional steps as much as possible. And then there are some people that have family histories. So something like the cancers. If your first degree female relative, so something like your mother or your sister or your daughter has had a breast cancer before or a cervical cancer before, it's likely that there's some genetic issues going on and that
You should be looking out.
You should be looking out. For the whites, sometimes they go do the genetic mapping, identify that they're eligible candidates, and then go take drastic measures to ensure that they don't get the cancers. But once your first-degree female relatives have had any form of cancers, please go do your screening. For the men, most time when you ask about the fathers and the uncles, unfortunately, as a part of the world, we don't talk about our diseases. We feel like the fewer people
They're hiding
know,
them.
yes, the better. Unfortunately, when you do that, we don't learn. If we don't know that people have had it. You have sons who are sending their fathers for chemoradiotherapy and they have no clue what it is that, yes, the men are being treated for.
Whoa.
And it's critical that we talk about prostate cancers.
Yeah.
Aside that, men's health in general,
And same
it's like a hash. Yes, men. Hey. So generally, men don't talk about their issues, but there are serious health issues that we need to discuss with them. If you have it, and you say one ton area,
I don't know why, but I think it's become a bit of a societal thing. We are too quick to stigmatize. And you remember when COVID came?
Yep.
I remember Dr. Selby, who was heading I think the National Health Insurance bit then. I was so proud of what she did because she contracted COVID and she came out and said, "Oh,
and made everybody know."
So that people realize it's nothing. But we hide everything, and like I say, once we do that, those close to us will suffer the same thing. Lessons that should have been learned, they don't even realize I have to pay attention to this, and then they also fall in the same.
So some people are getting cancers, and you are scratching your head as to what could have happened, just so that you can even structure your education. And they are like, "Oh, I sent my father for this, but I'm not sure what it was." How is that possible? It's critical that at least for the closest people, you don't need to broadcast it everywhere. Let your children understand some of the health issues that you have had, just so that they can also take preventive measures against these diseases. And as early as possible, the children can start screening for these diseases. Be on the lookout. Thankfully, most of these, when it is starting, it's a bit insidious, slow creeping, so you can catch them early. It's not a sudden thing that happens like the complications, like stroke, for instance. Most of them start on the very low tone. If you're able to screen, you will definitely be able to catch it. So we've talked about the family history, and for the cancers, we do talk about the radiation component, people that work in the industries. For instance, sometimes some of the machines have these
over time, they are
Over
exposing
time,
you.
it's sort of built up. Those industrial issues have been shown to cause some cancers as well. One cancer that the specific trigger is unknown is childhood cancers. It just happens. Yes. And for children, we call something early warning signs. So that's why we teach our primary healthcare providers. If you see any of these signs early and you bring the child, they can be treated completely. But unfortunately, in our part of the world, when 10 children get cancers, we are losing about 8 of them. In other parts of the world, 8 of the children are surviving. And they are losing just about 20%. We want to increase our survival rate from that horrible 20% towards the 80. And if
so I get what you're saying. In other jurisdictions, 8 out of 10 are surviving. Here, 2 out of 10.
Yep.
The reverse is true.
The reverse is true. Meanwhile, if most of these cancers were caught early, they could have been treated. Childhood cancers are treatable once they are found early. Sometimes the eye signs, they call them the cat's eyes. The mother will tell you, "Oh, looks like my baby's eye is glowing." One of the pupils, the black in the eye, turns whitish. And that is a clear early warning sign that something is growing inside the eye. Sometimes a child that was born with the eyes looking straight suddenly develops a squint. And the mother will tell you that it looks like one of the eyes straying away. Something is forcing the eye to look away. A child that has started walking suddenly decides they won't walk again because there's some pain ongoing somewhere, and they sort of reverse.
Yeah.
They started walking, now they are not walking. Sometimes there's unexplained signs, profuse vomiting, severe headaches, seizures that every lab has been done. You can't seem to find any explanation. We recommend that you refer these children as quickly as possible. And then also,
in other words, when you realize that there are some things that naturally will happen with children, they will get infected, they will go to.
That's very.
But when it becomes excessive, don't just assume, a normal.
No, a child
Check
with
them
a
out.
fever for more than 2 weeks, you are still giving painkillers. What are you treating? You know, children are one key group that when they are getting better, you see, suddenly they are jumping all over the place, playing, exactly. But these persisting symptoms that nobody can explain, we need to get help for them as quickly as possible. Unfortunately, for something like bone pain, the teachers will just beat them. Oh, this child is always in pain. They are always missing school. And we assume that, oh, they might be having sickle cell, you know, and they'll
when
go
it's not
out.
even been confirmed.
No. Unfortunately, you screen them and you notice that they are having some form of childhood cancer or these abnormal lumps. And it's really sad when sometimes you see them along the street, they are just soliciting for funds. And you want to inquire, the parents are actually even not willing to let you delve into what the issue might be. Unusual lumps anywhere in the body, it could be a childhood cancer. And we refer them straight to any of the tertiary hospitals. They can be treated.
Right.
So
and the good thing is, I've been told, is it there's one blastoma, there was a,
is for the eye.
yeah, there was a child, like, I hear the earlier you find those things, the better. I mean, generally, but I hear with the children, it's much easier. Once you see it early, it can be dealt with very easily.
Cancers that occur in children tend to replicate very fast. And once the cancer cells grows very fast, it means they can take up the medicine also very fast.
Oh, wow.
Yeah, so you find a child now, you tell the mother, kindly go to this place immediately. The mother decides that they don't have money, so they want to go home and come. By the time you see them, the tumor size could have doubled. So it is that process that the treatment also takes advantage of. Immediately you start the treatment, the cells sort of take up the medicine really fast, and you are able to totally treat childhood cancers once you are able to identify.
So that's the trick. That's the secret in there.
That's the trick in there. And I mean, you keep on, even mothers can identify these because they know their children. They are bathing the child, suddenly the child seems to be in some sort of pain. You report to your provider, let them do further examination. And if need be, they'll refer the child straight to. And because of that doubling time issues with children, we don't let them go through the normal referral system or refer to your district hospital, to the region. No, they refer them straight to the treatment site and they do the confirmation.
Which is where?
So you have a number of treatment sites across the country. Kolebu is one, Ridge Hospital, Greater Accra Regional Hospital is one, Konfanochi Teaching Hospital is one, Agogo is one, Tamale Teaching Hospital, and then the Volta Teaching Hospital, then Cape Coast Teaching Hospital as well. All of them would treat childhood cancers.
All right. So this one says, Pognab Awonalim says, please let doctor know that not all the medical officers can detect the diagnosis very early.
Yeah.
This makes the caregivers give early, I don't know what, because they have attended different health facilities, especially in the rural areas. It's from Analim Amwak from Sandema.
Yeah, we totally agree.
What's your reflection on that?
The issue with early detection and diagnosis is one key thing that has been identified across all cadres of staff. You know, the health system is sort of structured to be very responsive towards the infectious diseases. See, when COVID came, the way, you know, we were all mobilized to quickly address it. But for the infectious diseases, maximum you've taken your antibiotics for 5-7 days, we are done with you. Yeah. So life can go on. Unfortunately, for these chronic diseases, their nature is a bit different. So at the primary healthcare, providers are being reoriented in order to, one, identify them early enough. And once they've identified the appropriate management to give up for that level, is also being taught. There are multiple projects going on across the country that is ensuring that primary healthcare providers, you know, their skills can be topped up in order to detect NCDs. Well, you mentioned even
CHIPS compound, so it means we must do that because even if at the CHIPS compound level,
CHIPS,
they must know
health centers, district hospital, all the way up. And this time it includes private facilities, faith-based groups. Because when the disease is coming, it's not going to discriminate who it affects. No. So it's critical that we can sort of ensure all health workers have some skill to be able to detect it early, to make the right decision. So I totally agree with him. Yeah.
Now, you made mention a short while ago of the 20% surviving here.
for childhood
versus the
cancers.
80%
Yes.
in other countries. But let's talk about generally the NCDs. When you look at the different regions, what's the regional distribution like? Paint a picture for us. I know definitely some regions are suffering more than others
so
because of access and all. Tell us about that.
There are regional variations for all diseases. Now, we noticed that most complications such as hypertension, strokes, heart attacks, kidney disease, and they tend to cluster around the treatment sites. So it is not that the disease is coming from that region, but ultimately you will be referred
to that place.
To that place because of the treatment. You cannot get dialysis in a typical district hospital. Yeah. So you'll be referred and you ultimately either end up in Korle Bu, Komfo Anokye. So their numbers are always soaring. It is not because Greater Accra has more of those diseases, but because we have the centers right here with us. But things like, I'll come back to the childhood cancers again. Some of the childhood cancers have been mapped out to specific places. And a lot more studies are ongoing to find out if the issues were environmental or dietary or what specific. It's been found out that a lot of the children come from specific regions. However, for me, I don't like to delve too much into regional. Whether your region has more of type A or type C disease, it doesn't mean that you cannot get it.
Okay.
You, the individual, when it affects you,
it doesn't make you immune.
It doesn't make you immune to getting it. Because we just finished having a STEP survey, that's a NCD risk factor assessment survey. And it talks about all the risk factors. It takes the physical measurements and then it measures the lab components as well. And the data is now being analyzed. But the preliminary data is showing that across all regions.
All regions?
All 16 regions of Ghana.
Yeah?
The NCDs are being reported. The risk factors are soaring in all regions by chemicals. So for me, I like to talk about us as Ghanaians. We need to be able to address these issues before it gets out of hand. It's like a ticking time bomb. And also, if you take the hypertension, diabetes, previously, people go way beyond pension before you start somebody developing hypertension or diabetes. Now 20, 30-year-olds are coming up with diabetes. So how long is this person going to be on medication?
A lot of middle-aged people, 30, 40-year-olds, quite a number of those I know, have had some stint with. Yes. Some of them are on medication.
Yes.
And I hear once you start with the medication, it's a lifelong.
It's a lifelong
so
thing. And that alone puts
it creates other problems for you.
Absolutely. And the voices out there in the community, you are preaching management. They go to the trot stage. Somebody says, I will cure your diabetes. So straight away, and this is somebody who has been told that your condition is going to be for life. They would obviously want to try out a cure. Yeah. The next thing we know are terrible complications that are coming up.
Maybe they've ended with kidney failure.
Yep.
And all
so
of that.
It's crucial that although it is lifelong, people who have been on their medicines for decades, if they don't tell you, you would have no clue. Yeah. Once you are taking the medicines regularly, you are following the schedule, you live a
checking
very
your
normal,
blood pressure, ensuring that things are right.
And they have these annual medical checks that are recommended for them, just to know how the blood work is also behaving. You can lead a very normal life. But there's put some stigma with the medications, and it's critical because of the people are actually stopping their medicines.
That's
going to try other things and coming back in much worse states. Yesterday, we met the Society of Private Medical and Dental Practitioners. And that was their number one complaint, that for all the complications they are seeing, these are people that when you go into their histories, they were informed years back that, oh, your blood pressure is a bit high.
Deal with it.
It's important that you keep an eye on it. Then medicines were started. They heard that, oh, if you take the medicines, commonest complaint is you can't perform.
I was just about to get there that the men are also complaining that
they do.
Once you start with the hypertension medication, they check like, bugger, I am red.
So why do we target to the medication whilst the hypertension itself
is what is causing your
and the
decrease in libido?
Yes, and
that's what decreases your libido
itself. No, these conditions affect your blood vessels. That's why we insist on the control.
Yeah.
So it starts damaging your blood vessels. It starts damaging your nerves. So if the control is not well done, that one alone is enough to give you plenty issues.
And an erection is blood work.
Of course.
It's not like some animals that have bones. This is blood work.
Yes. So the two conditions themselves, unfortunately, when one person gets one, you're likely to also get the other if you don't put in enough checks. So the medications are rather protective. However, some way, somehow, we've coined this misconceptions around antihypertensive, antidiabetics that you can get this.
Doc, I want you to
make
this point very, because I have met a number of men who say, oh, Mejai Kakra because my hypertension medication is making my...
Yep, and that Mejai Kakra is what brings us the strokes. So when you are on the medicines, it's like having a ball put in water. The medicine is your hand. You put your hand on the ball goes underwater. It doesn't mean the ball doesn't exist.
But it's being controlled.
The control has put it underwater. You are living a very normal life. Immediately you withdraw the control, the ball pops back up. And your blood pressure shoots through the roof. And the next thing you know, it's a stroke. It's a heart attack. It's you know, and it's
I had two gentlemen join me in the studio some weeks back who have kidney disease. They are doing dialysis. One says by the time he ended up, I think he wasn't even checking, his blood pressure was, it had gone through the roof.
Yes.
And that was how they even realized that his kidneys were beginning to fail.
High blood pressure is enough to destroy your kidney. The kidney is made up of multiple blood cells. Tiny, tiny blood vessels in the kidney. So some are bursting, some are not getting enough blood flow. It will destroy the kidneys. The sugar, blood sugar does the same thing. So as for the medicine component, we keep ranting and shouting about it because a lot of people have that mindset that once I start, I'm going to have issues. So let me stop a little. And then and somebody actually said that it is when the BP is going up that he looks for his medicines. And when blood pressure is rising, you don't notice. By the time you have that headache, it's almost too late. So you don't assume that because I'm not feeling anything, nothing is happening. That's why we ask people to screen. You do the screening when you are not sick, because at that time you have no symptoms at all, and that's when your blood pressure starts misbehaving and rising up. But when you screen, then the machine will be able to pick the high value. Sometimes you tell the people and they don't believe you that, no, I went to work. How can my blood pressure be this high? So if you would notice that some people who actually go to work and go and collapse at their tables, if they were sick, they wouldn't have left the house. But because hypertension, you don't notice. It hasn't come with any symptom. By the time the symptoms start, the stroke is about to start. So it is critical that we don't wait to start feeling something before we seek for it. And as a society, generally, we don't visit health facilities if we are not sick. It's as if once you are going to the hospital, you must be sick.
And can't share for me.
I would like to say that for every growing adult in Ghana, with all the stresses everywhere,
and God knows we have many.
Oh, yes.
Stress is not dorsal.
Going
to the market alone can shoot your hypertension.
It's enough to raise your blood pressure.
But let me find out from you. As we talk about all of these things, because you spoke about risk factors, and then you mentioned biochemical triggers and all of that. Recently, we've got reports about galamsey and what it's doing to food, drink, and all that. Are you noticing anything tied to that?
So galamsey is one issue that clearly has to do with the chemical seeping into our water bodies. There have been multiple studies by our universities at these galamsey sites based on reports of, abnormal behaviors, abnormal eatings, abnormal births in these communities. And a lot of research has been ongoing. Some of the chemicals, something like mercury, for instance, it has actually been banned. Now, even the mercury sphic, the BP measuring, there was one that, you pull the thing and then the mercury drops. It is being replaced by the electronic ones because of the dangers of the mercury chemical. And in washing the gold, they use mercury in order to extract the gold from the soil. So it has like a direct linkage to health issues, and these health issues have been observed in these communities around Galamsey sites. So that is one of the public health interventions that are put in place at these sites, likely to educate the communities, because when the miners also come, they use local people to mine for their gold. They will take their gold away, and you are left with the remnant disease conditions, and it doesn't help. It doesn't help at all. Yeah.
So to conclude the conversation, in some of these cases, yes, we've spoken a bit about the management. Take your medication and do that. What else can you say about management, and how, I want you to reiterate, how are we all expected to do better to safeguard our lives? That will be the final bit to you.
So for public health, we like to sort of segregate the general population into people who are unexposed, let's say the younger children or teenagers who are not having any early signs and symptoms of these non-communicable diseases. It is critical that we start the awareness creation in the unexposed so that they can build up these healthier habits and not grow to acquire the hypertension, the diabetes, amongst others. And there are people who have subclinical signs, or the diseases have started, but it is the very early stages such that it is only through screening that the diseases can be picked up. Okay. We recommend that for any adult, once you're above 18 years, some people do, some countries, they want to do 30 years. Looking at our country profile and the age at which people are reporting with these conditions, every adult, even for the children, school health has started routinely to screen the children for most of these common diseases. So for the adults, it is important that at least once a year you do a full medical checkup. Besides that, once a month, just pass through any of these pharmacy shops, drug shops, and ask them to check your blood pressure. Blood sugar, you can do it once a year. Otherwise, if the blood sugar is high and it has been recommended that you do it more than once a year, that is also fine. Yeah. But once you are not sick, let us try and get that yearly or annual medical checkup done. And you'll be surprised that will also do your blood work. So if there's anything going on in the blood, it can be seen. And then we have people who have full-blown NCDs, people who have been diagnosed with either hypertension, diabetes, or any of the cancers. For them, we continue to motivate them to stick to their medicines. Okay. That is one sure way of ensuring that you lead a very normal, productive, and healthy life. Okay. Do not be swayed by the messaging about cure, because it is very rampant. And if you are not careful, you rather come back with a lot of complications. Ensure that you are taking your medicines regularly and sticking to the schedule that is provided. And I want to also add on people who are caregivers to persons living with NCDs. Most times they are forgotten. Now, once somebody gets this chronic disease and gets a complication like, let's say, a stroke, they sort of need to have a regular caregiver that they will be depending on. Most times, these caregivers are also coming down with hypertension because of the stresses of taking care of somebody, and nobody really considers what their health is what is happening in their health. It's important that if you are taking care of somebody with any chronic disease at all, once a year, you to kindly get your blood pressure. I tell them that when you bring the person to the hospital, whilst the person is going through the motion, you go check your blood pressure as well. Yeah. You never know what can be picked up. Yeah. And let us remember that most of these NCDs are preventable. Yeah. We need to consciously put in an effort to maintain a healthy lifestyle. Unfortunately, in our part of the world, it's becoming more and more expensive if you want to eat very healthy. But there are basic things such as planting a few vegetables in a small bowl at home that we can adopt. Right. There are some things like watching out for where you buy your food from. Right. Watching out for how healthy the food that you are putting into your mouth, whether it has less oil or the oil is soaking the whole plastic container or something like that. These basic measures would ensure that we are able to curb the NCDs and really control our lives. So ultimately, we all need to be having more productive lives as a people.
Well, and of course, longevity will also affect our country in terms of its productivity. But Doc, we thank you for the education. We're very grateful. Dr. Efuakome is Acting Programs Manager, Non-Communicable Diseases at the Ghana Health Service. Now.